Question 1. Governance review demonstrates that a 55-year-old male presents with a 2-week history of intermittent fatigue, mild shortness of breath on exertion, and a subjective feeling of indigestion. He denies chest pain, fever, or significant weight loss. His past medical history is significant for hypertension controlled with lisinopril and hyperlipidemia treated with atorvastatin. He is a former smoker, quitting 10 years ago. Which of the following initial diagnostic approaches best reflects a systematic and comprehensive clinical reasoning process for this patient? Option A. Order a complete blood count, basic metabolic panel, electrocardiogram, and chest X-ray to evaluate for common causes of fatigue and shortness of breath. Option B. Initiate empiric treatment for anxiety and depression, as these are common causes of somatic symptoms in this age group. Option C. Focus on gastrointestinal causes given the indigestion, and order an upper endoscopy and stool guaiac test. Option D. Obtain a detailed psychosocial history, including recent stressors and sleep patterns, and perform a thorough cardiovascular and pulmonary examination before ordering any investigations. The correct answer is A. Order a complete blood count, basic metabolic panel, electrocardiogram, and chest X-ray to evaluate for common causes of fatigue and shortness of breath. Explanation: this scenario presents a common challenge in family medicine. A patient with a constellation of nonspecific symptoms that could indicate a wide range of conditions, from benign to life-threatening. The professional challenge lies in efficiently and accurately narrowing down the differential diagnosis, while considering the patient's individual risk factors, history, and the potential impact of delayed or incorrect diagnosis. The physician must balance thoroughness with practicality, avoiding both over-investigation and under-investigation. The correct approach represents best professional practice by systematically gathering and synthesizing information to build a prioritized differential diagnosis. This involves a comprehensive history, a focused physical examination, and the judicious selection of diagnostic tests based on the most likely and most serious conditions. This aligns with the American Board of Family Medicine's emphasis on evidence-based practice and patient-centered care, ensuring that diagnostic efforts are directed towards the most probable causes and that critical diagnoses are not missed. It also reflects the ethical obligation to provide competent care and to act in the patient's best interest. An incorrect approach that relies solely on a single symptom or a limited set of symptoms without considering the broader clinical picture would be professionally unacceptable. This could lead to a failure to identify serious underlying conditions, violating the ethical duty to provide comprehensive care and potentially leading to patient harm. Similarly, an approach that immediately jumps to ordering extensive, nonspecific tests without a clear diagnostic hypothesis would be inefficient and potentially expose the patient to unnecessary risks and costs, failing to adhere to principles of judicious resource utilization and evidence-based medicine. Another incorrect approach might be to dismiss the symptoms as psychosomatic without a thorough medical workup, which is a diagnostic error that can have severe consequences. The professional decision-making process for similar situations should involve a structured approach. 1. Initial assessment. Gather chief complaint, history of present illness, and relevant past medical history. 2. Develop a broad differential diagnosis. List all plausible conditions that could explain the patient's symptoms. 3. Prioritize the differential. Rank the diagnoses based on likelihood, severity, and treatability. Consider can't-miss diagnoses. 4. Formulate a diagnostic plan. Select appropriate physical exam maneuvers and diagnostic tests to confirm or refute the prioritized diagnoses. 5. Reevaluate and refine. Continuously reassess the differential diagnosis as new information becomes available from the history, physical exam, and diagnostic tests. Question 2. The assessment process reveals a 28-year-old female patient presenting for routine gynecological care. She expresses a desire to discuss long-acting reversible contraception, LARC, options. Her past medical history is notable for well-controlled hypertension managed with lisinopril and a history of migraines with aura. She has no known allergies. She is seeking a highly effective method of contraception. Which of the following approaches best addresses this patient's contraceptive needs? Option A. Advise the patient that due to her history of migraines with aura, hormonal contraception is contraindicated, and she should consider non-hormonal methods only. Option B. Recommend the contraceptive implant without further discussion, as it is a highly effective LARC method and generally well tolerated. Option C. Conduct a thorough review of her medical history, including her hypertension and migraine history. Discuss the efficacy and safety profiles of various LARC methods, e.g., IUD, implant, and explore her preferences and lifestyle factors to collaboratively select the most appropriate method. Option D. Immediately prescribe a combined oral contraceptive pill, COP, as it is a common and effective method, assuming her hypertension and migraines are not significant contraindications. The correct answer is C. Conduct a thorough review of her medical history, including her hypertension and migraine history. Discuss the efficacy and safety profiles of various LARC methods, e.g., IUD, implant, and explore her preferences and lifestyle factors to collaboratively select the most appropriate method. Explanation. Scenario analysis. This scenario presents a common yet complex clinical challenge in family medicine, managing a patient's contraceptive needs while navigating potential contraindications and patient preferences. The professional challenge lies in balancing evidence-based guidelines with individual patient factors, ensuring shared decision-making, and providing comprehensive counseling that addresses efficacy, safety, and lifestyle consideration. The physician must also be aware of potential drug interactions and the patient's medical history to avoid adverse outcomes. Correct approach analysis. The correct approach prioritizes a thorough assessment of the patient's medical history, including any contraindications to hormonal contraception, and a detailed discussion of various contraceptive methods. This aligns with the American Board of Family Medicine's emphasis on patient-centered care and evidence-based practice. Specifically, it adheres to guidelines from organizations like the Centers for Disease Control and Prevention, CDC, for contraceptive use, which provide detailed recommendations on method selection based on medical eligibility criteria. This approach ensures that the patient receives accurate information to make an informed choice that is both safe and effective for her individual circumstances, fostering trust and adherence. Incorrect approaches analysis. Recommending a specific method without a comprehensive medical history review and discussion of alternatives fails to adhere to the principle of individualized care and may overlook critical contraindications, posing a significant health risk. This violates ethical obligations to provide safe and appropriate care. Prescribing a method solely based on the patient's stated preference without exploring potential risks or contraindications, or offering alternative options, represents a failure in due diligence and shared decision-making. It can lead to suboptimal outcomes or adverse events. Focusing exclusively on the most effective method without considering the patient's lifestyle, concerns, or potential side effects neglects the holistic aspect of patient care and the importance of patient autonomy in contraceptive decision-making. This can result in non-adherence and unintended pregnancies. Professional reasoning. Professionals should approach contraceptive counseling by first establishing rapport and understanding the patient's reproductive goals and concerns. A systematic review of the patient's medical history, including current medications and any pre-existing conditions, is paramount. This should be followed by an evidence-based discussion of available contraceptive methods, detailing their efficacy, safety profiles, non-contraceptive benefits, and potential side effects. Shared decision-making, where the patient actively participates in choosing a method that aligns with her values and lifestyle, is the cornerstone of best practice. Professionals should be prepared to address patient questions and concerns thoroughly, ensuring comprehension and empowering the patient to make an informed choice. Question 3. Compliance review shows a family physician is managing a patient who suddenly collapses in the office, exhibiting signs of respiratory distress and unresponsiveness. The physician's immediate actions are being evaluated for adherence to emergency procedures and risk assessment protocols. Which of the following approaches best reflects the required standard of care in this emergent situation? Option A. Begin a detailed review of the patient's electronic health record to identify potential pre-existing conditions that might explain the collapse. Option B. Administer intravenous fluids and pain medication to stabilize the patient before assessing airway and breathing. Option C. Wait for the patient to regain consciousness and verbally report their symptoms before initiating any interventions. Option D. Immediately initiate advanced airway management and cardiopulmonary resuscitation, while simultaneously calling for advanced life support. The correct answer is D. Immediately initiate advanced airway management and cardiopulmonary resuscitation while simultaneously calling for advanced life support. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in family medicine, managing a patient experiencing a sudden, life-threatening event where immediate, decisive action is paramount. The professional challenge lies in rapidly assessing the situation, prioritizing interventions based on the patient's immediate needs, and ensuring adherence to established emergency protocols while maintaining patient safety and dignity. The urgency of the situation, coupled with the potential for rapid deterioration, demands a systematic yet swift approach to risk assessment and intervention. Correct approach analysis. The correct approach prioritizes immediate life-saving interventions based on a rapid assessment of the ABCs: airway, breathing, circulation, and the patient's overall clinical status. This aligns with established emergency medical protocols and the core ethical duty of beneficence, which mandates acting in the patient's best interest, especially in emergent situations. The American Board of Family Medicine emphasizes competence in managing acute medical emergencies, which includes the ability to quickly identify and address life threats. This approach ensures that the most critical physiological functions are stabilized first, thereby maximizing the chances of survival and minimizing irreversible damage. It reflects a proactive and evidence-based strategy for emergency care. Incorrect approaches analysis. An approach that delays critical interventions to first gather extensive historical data or perform non-emergent diagnostic tests is professionally unacceptable. This failure constitutes a breach of the duty of care and potentially violates regulations requiring timely and appropriate emergency medical treatment. Such a delay could lead to irreversible harm or death, representing a significant ethical and legal failure. Similarly, an approach that focuses on less critical symptoms or signs before addressing immediate threats to life, e.g., prioritizing pain management over airway assessment, demonstrates a flawed understanding of emergency triage and risk assessment. This misprioritization can result in the patient's condition worsening significantly, while less urgent matters are addressed, violating the principle of non-maleficence, do no harm, and the professional obligation to manage emergencies effectively. An approach that relies solely on patient self-reporting of symptoms without independent clinical assessment in an emergent situation is also a failure, as it abdicates the physician's responsibility for direct patient evaluation and decision-making in a critical event. Professional reasoning. Professionals facing such a scenario should employ a structured approach to emergency management. This involves 1. Rapid primary survey ABCs. Immediately assess and manage airway, breathing, and circulation. 2. Secondary survey. Once the patient is stabilized, conduct a more thorough head-to-toe assessment. 3. Identify and treat reversible causes. Actively look for and address underlying causes of the emergency. 4. Continuous reassessment. Monitor the patient's response to interventions and adjust the treatment plan accordingly. 5. Documentation. Accurately record all assessments, interventions, and patient responses. This systematic process, grounded in established emergency protocols and ethical principles, ensures that critical needs are met promptly and effectively, while also providing a framework for comprehensive care. Question 4. The performance metrics show a concerning trend of underutilization of recommended colorectal cancer screening among patients aged 50-75 within the family medicine practice. Several strategies are being considered to address this gap. Option A. Focus solely on providing a pamphlet about colorectal cancer screening in the waiting room and expect patients to initiate the conversation. Option B. Mandate that all patients aged 50-75 undergo a colonoscopy annually, regardless of individual risk factors or prior screening history. Option C. Rely on patients to independently schedule their colorectal cancer screening appointments when they feel it is time, assuming they are aware of the guidelines. Option D. Implement a proactive recall system that automatically flags eligible patients for screening, coupled with patient education materials and a structured approach to shared decision-making during routine visits. The correct answer is D. Implement a proactive recall system that automatically flags eligible patients for screening, coupled with patient education materials and a structured approach to shared decision-making during routine visits. Explanation. Scenario analysis. This scenario presents a common challenge in primary care, balancing evidence-based screening recommendations with individual patient factors and resource limitations. The performance metrics highlight a potential gap in adherence to established guidelines, prompting a review of practice patterns. The professional challenge lies in identifying the most effective and ethically sound strategy to improve screening rates while respecting patient autonomy and the practicalities of a busy family medicine practice. Correct approach analysis. The correct approach involves a systematic, multifaceted strategy that leverages both patient-level interventions and practice-level improvements. This aligns with the American Board of Family Medicine's emphasis on evidence-based medicine and continuous quality improvement. Specifically, implementing a robust recall system, utilizing patient education materials, and engaging in shared decision-making are all recognized best practices for enhancing preventive care. These methods directly address barriers to screening, such as patient forgetfulness, lack of awareness, or concerns about the screening itself. This approach is ethically sound as it prioritizes patient well-being and informed consent, and it is regulatorily compliant by adhering to established screening guidelines and promoting quality patient care. Incorrect approaches analysis. One incorrect approach focuses solely on provider-level reminders without addressing patient engagement or systemic issues. This fails to acknowledge that screening adherence is a shared responsibility, and that patients may have unique barriers to participation. It is ethically deficient because it places the onus entirely on the provider, without empowering the patient or addressing potential systemic inefficiencies. Another incorrect approach involves mandating screenings without considering individual patient risk factors or preferences. This violates the principle of patient autonomy and can lead to unnecessary anxiety, cost, and potential harm from overscreening. It is ethically problematic as it bypasses informed consent and shared decision-making, and it may not be compliant with guidelines that emphasize individualized care. A third incorrect approach that relies solely on patient self-initiation of screening appointments without any proactive outreach is also professionally unacceptable. This approach is passive and fails to account for the fact that many patients may not be aware of recommended screenings, may have competing priorities, or may experience barriers to accessing care. It is ethically deficient as it neglects the proactive role a family physician should play in promoting health maintenance and may lead to significant health disparities. Professional reasoning. When faced with performance metric deviations related to health maintenance and screening, a family physician should engage in a process of root cause analysis. This involves examining patient factors, provider workflows, and practice systems. The decision-making process should prioritize evidence-based guidelines, patient-centered care, and ethical principles, including beneficence, non-maleficence, and autonomy. Strategies should be developed collaboratively with the care team and patients, aiming for sustainable improvements in health outcomes. Question 5. Stakeholder feedback indicates a desire to improve the identification of patients at high risk for chronic disease complications, and a new evidence-based risk assessment tool has been identified. However, concerns have been raised by physicians regarding the potential impact on clinic workflow and patient engagement. Which of the following represents the most professionally sound approach to implementing this new tool? Option A. Initiate a pilot program in a subset of the practice to evaluate the tool's usability, accuracy, and impact on workflow, collecting feedback from physicians, staff, and patients before considering broader implementation. Option B. Immediately mandate the use of the new risk assessment tool for all physicians in the practice to ensure consistent application and maximize potential benefits. Option C. Rely exclusively on the vendor's published data and testimonials to justify the tool's adoption and proceed with universal implementation. Option D. Implement the tool on a trial basis for a limited period, but without formal data collection or structured feedback mechanisms from stakeholders. The correct answer is A. Initiate a pilot program in a subset of the practice to evaluate the tool's usability, accuracy, and impact on workflow, collecting feedback from physicians, staff, and patients before considering broader implementation. Explanation. Scenario analysis. This scenario presents a common implementation challenge in family medicine, integrating a new risk assessment tool into established workflows while addressing diverse stakeholder concerns. The challenge lies in balancing the potential benefits of improved risk identification with the practical realities of physician time constraints, patient engagement, and the need for a standardized, evidence-based approach. Family physicians must navigate these competing demands to ensure patient safety and quality of care without overburdening the practice. Correct approach analysis. The correct approach prioritizes a phased, evidence-based implementation that includes pilot testing and ongoing evaluation. This aligns with best practices in quality improvement and patient safety initiatives, which are implicitly supported by the American Board of Family Medicine's emphasis on lifelong learning and evidence-based practice. Pilot testing allows for real-world assessment of the tool's usability, accuracy, and impact on workflow within the specific practice setting. Incorporating feedback from all stakeholders, physicians, staff, and patients, ensures buy-in and facilitates necessary adjustments. Continuous evaluation, using metrics related to risk identification rates and patient outcomes, is crucial for demonstrating the tool's effectiveness and making data-driven decisions about its broader adoption or modification. This systematic approach minimizes disruption and maximizes the likelihood of successful integration, ultimately enhancing patient care. Incorrect approaches analysis. One incorrect approach might involve mandating immediate, widespread adoption of the new tool without any pilot testing or stakeholder input. This fails to acknowledge the practical challenges of workflow integration and physician burden, potentially leading to resistance, decreased adherence, and a failure to realize the tool's intended benefits. Bypasses the crucial step of validating the tool's effectiveness and usability in the actual practice environment, which is a cornerstone of evidence-based implementation. Another incorrect approach could be to rely solely on the vendor's claims of efficacy without independent practice-level validation. While vendor data can be informative, it may not reflect the unique patient population or operational context of a specific family medicine practice. This approach risks adopting a tool that is not truly effective or efficient for the intended users, potentially leading to wasted resources and compromised patient care. It neglects the professional responsibility to critically evaluate and adapt evidence to local needs. A third incorrect approach might involve implementing the tool without adequate training or support for physicians and staff. This would likely result in frustration, incorrect use of the tool, and a reluctance to engage with it, undermining its purpose. Effective implementation requires not just the tool itself, but also the necessary human capital development to ensure its proper utilization. This overlooks the ethical imperative to provide competent care, which includes ensuring that practitioners are adequately prepared to use new technologies. Professional reasoning. Professionals should approach the implementation of new risk assessment tools by first understanding the evidence supporting their use and then considering the practicalities of their integration into their specific practice. A structured approach involving stakeholder engagement, pilot testing, and ongoing evaluation is essential. This process allows for a data-driven decision on whether and how to adopt the tool, ensuring it enhances patient care and aligns with professional standards and ethical obligations. Question 6. The risk matrix shows a moderate probability of a measles outbreak in the community due to declining vaccination rates. A parent expresses significant concern about the recommended childhood immunization schedule, citing anecdotal evidence of vaccine side effects and questioning the necessity of multiple vaccines at young ages. The family physician needs to address these concerns while ensuring the child receives appropriate protection according to established guidelines. Which of the following represents the most appropriate course of action? Option A. Provide the parents with a list of alternative, non-traditional vaccination schedules found online, allowing them to choose what they feel is best. Option B. Dismiss the parents' concerns as unfounded and insist on immediate adherence to the full vaccination schedule without further discussion. Option C. Agree to a significantly delayed immunization schedule, administering vaccines one at a time over several years, to alleviate the parents' immediate anxieties. Option D. Engage in a thorough discussion with the parents, acknowledging their concerns, and providing evidence-based information from the CDC and AAP regarding vaccine safety, efficacy, and the benefits of adhering to the recommended schedule. The correct answer is D. Engage in a thorough discussion with the parents, acknowledging their concerns, and providing evidence-based information from the CDC and AAP regarding vaccine safety, efficacy, and the benefits of adhering to the recommended schedule. Explanation. Scenario analysis. This scenario presents a common challenge in family medicine, navigating parental concerns about vaccine safety and efficacy while adhering to established public health recommendations. The challenge lies in balancing the physician's duty to provide evidence-based care and protect the child's health with the parents' right to make informed decisions for their child. Misinformation and vaccine hesitancy are prevalent, requiring physicians to be adept at communication, education, and empathetic engagement. The physician must also consider the legal and ethical obligations to follow recommended immunization schedules, which are designed to achieve herd immunity and prevent outbreaks of serious infectious diseases. Correct approach analysis. The correct approach involves a comprehensive discussion with the parents, acknowledging their concerns, and providing accurate, evidence-based information about the recommended immunization schedule. This aligns with the American Academy of Pediatrics (OP) and Centers for Disease Control and Prevention (CDC) guidelines, which are the foundational regulatory frameworks for pediatric immunization in the United States. The physician should explain the benefits of vaccination in preventing serious illness, the safety profile of vaccines, and the scientific consensus supporting the recommended schedule. This approach upholds the physician's ethical duty to promote patient well-being and adhere to established public health standards, ensuring the child receives optimal protection against preventable diseases. It also respects the parent's role in decision-making by empowering them with accurate information. Incorrect approaches analysis. One incorrect approach is to dismiss the parent's concerns outright or to become defensive. This can alienate parents, erode trust, and make them less receptive to any medical advice. Ethically, it fails to uphold the principle of patient-centered care and informed consent. Legally and professionally, it deviates from the standard of care, which mandates open communication and addressing parental questions. Another incorrect approach is to agree to a significantly delayed or altered immunization schedule without a strong medical justification. Some flexibility may exist in certain circumstances. Deviating substantially from the recommended schedule can leave the child vulnerable to serious infections during critical developmental periods. This approach fails to adhere to the established guidelines from the CDC and AAP, which are based on extensive scientific research and epidemiological data to provide the earliest and most effective protection. It also risks contributing to vaccine hesitancy and undermining public health efforts. A third incorrect approach is to provide incomplete or misleading information, such as focusing solely on the risks of vaccines without adequately discussing the benefits and risks of the diseases they prevent. This is ethically unsound as it violates the principle of truthfulness and can lead to an uninformed decision. It also fails to meet the professional standard of providing comprehensive and balanced information necessary for true informed consent. Professional reasoning. When faced with parental concerns about immunizations, a family physician should employ a structured approach. 1. Active listening and empathy. Begin by actively listening to the parent's concerns without interruption and acknowledging their feelings. Validate their desire to protect their child. 2. Education and information. Provide clear, accurate, and evidence-based information about the recommended immunization schedule, the diseases vaccines prevent, and the safety and efficacy of vaccines. Utilize resources from reputable organizations like the CDC and AAP. 3. Address specific concerns. Directly address the specific misinformation or anxieties the parents have raised, providing scientific explanations and data. 4. Shared decision-making. Engage in a shared decision-making process, discussing the risks and benefits of vaccination versus non-vaccination. 5. Documentation. Thoroughly document the conversation, including the concerns raised, the information provided, and the parent's decision. 6. Follow-up. If parents remain hesitant, offer follow-up appointments to continue the discussion and provide additional resources. Question 7. The efficiency study reveals that a significant number of patients are overdue for their routine gynecological exams and screenings, impacting departmental performance metrics. As a family physician, you are tasked with improving these metrics. Which of the following actions best balances the need for improved efficiency with the ethical imperative of providing comprehensive patient care? Option A. Focus on scheduling appointments for patients who actively request them, as this indicates higher patient engagement and will naturally improve efficiency. Option B. Prioritize scheduling appointments for patients who are most likely to attend, based on past attendance records, to maximize the number of completed screenings within the study period. Option C. Document all overdue screenings in patient charts and flag them for review during future appointments, assuming patients will prioritize their health when they are ready. Option D. Implement a proactive outreach program to remind patients of their overdue screenings, offering flexible scheduling options and exploring potential barriers to their attendance. The correct answer is D. Implement a proactive outreach program to remind patients of their overdue screenings, offering flexible scheduling options and exploring potential barriers to their attendance. Explanation: the efficiency study reveals that a significant number of patients are overdue for their routine gynecological exams and screenings, impacting departmental performance metrics. This scenario presents a professional challenge because it pits the need for efficient resource allocation and adherence to performance targets against the physician's primary ethical and professional obligation to provide patient-centered care and ensure timely preventive health services. Balancing these competing demands requires careful judgment to avoid compromising patient well-being for the sake of metrics. The correct approach prioritizes patient health and adherence to established clinical guidelines for preventive care. This aligns with the American Board of Family Medicine's commitment to evidence-based medicine and the ethical imperative to advocate for patients' health needs. By proactively reaching out to patients and addressing their overdue screenings, the physician upholds their professional responsibility to deliver high-quality, comprehensive care, which includes preventive services crucial for early detection and management of gynecological conditions. This approach respects patient autonomy by offering them the opportunity to engage in their health maintenance and ensures that care is not solely dictated by efficiency metrics. An incorrect approach that focuses solely on meeting efficiency targets without addressing the underlying reasons for missed appointments or proactively engaging patients fails to uphold the physician's ethical duty of beneficence and non-maleficence. It risks patient harm by allowing potentially serious conditions to go undetected. Another incorrect approach that involves pressuring patients into appointments they may not be ready for or cannot accommodate without exploring barriers to care infringes upon patient autonomy and can erode the patient-physician relationship. A third incorrect approach that involves simply documenting the overdue status without any follow-up action or investigation into barriers neglects the physician's responsibility to ensure patients receive necessary preventive care and may be seen as a failure to act in the patient's best interest. Professional decision-making in such situations requires a framework that integrates clinical judgment, ethical principles, and an understanding of patient circumstances. This involves assessing the clinical urgency of the overdue screenings, identifying potential barriers to care e.g., financial, logistical, personal, and developing individualized strategies to re-engage patients. Communication, empathy, and a commitment to patient education are paramount. The physician should consider implementing reminder systems, offering flexible scheduling options, and addressing patient concerns to facilitate timely access to care, rather than allowing efficiency metrics to dictate patient management. Question 8. The audit findings indicate a pattern of delayed identification of potential speech and language delays in children between 18 and 30 months of age, presenting for routine well-child visits. A review of several charts revealed instances where parental concerns regarding a child's limited vocabulary were noted but not systematically followed up with a comprehensive developmental assessment or referral. Considering the American Board of Family Medicine's emphasis on evidence-based practice and patient-centered care, which of the following represents the most appropriate course of action for the family medicine practice to address this audit finding? Option A. Focus on addressing acute medical issues during well-child visits and suggest that speech and language development concerns are best managed by pediatric subspecialists, limiting the practice's direct involvement. Option B. Implement a standardized developmental screening tool for speech and language at all well-child visits for children within this age range, and ensure clear protocols for follow-up and referral based on screening results. Option C. Educate parents on typical speech and language development and advise them to seek external specialist evaluation if they have significant concerns, without formalizing practice-based screening. Option D. Document parental concerns in the chart, but defer any formal developmental assessment or referral until the child reaches 3 years of age, assuming most delays resolve spontaneously. The correct answer is B. Implement a standardized developmental screening tool for speech and language at all well-child visits for children within this age range, and ensure clear protocols for follow-up and referral based on screening results. Explanation: scenario analysis. This scenario presents a common challenge in family medicine, identifying and addressing potential developmental delays in a young child. The audit findings highlight a potential gap in care, emphasizing the need for vigilant monitoring of growth and development against established benchmarks. The professional challenge lies in accurately assessing the child's progress, differentiating between normal variations and significant delays, and initiating appropriate interventions or referrals in a timely manner, all while adhering to established pediatric guidelines and best practices. Correct approach analysis. The correct approach involves a comprehensive assessment that integrates multiple data points, including parental concerns, direct observation of the child's behavior and skills, and comparison against age-appropriate developmental milestones. This aligns with the American Academy of Pediatrics Bright Futures guidelines, which are foundational for well-child care in the U.S. These guidelines emphasize a holistic approach to development, encompassing gross and fine motor skills, language, social-emotional development, and cognitive abilities. Early identification and intervention are critical for optimizing outcomes, as supported by numerous studies and recommended by professional bodies. This approach prioritizes the child's well-being and adherence to evidence-based pediatric care standards. Incorrect approaches analysis. One incorrect approach involves dismissing parental concerns without a thorough evaluation. This fails to acknowledge the value of parental input, which can be an early indicator of developmental issues. Ethically, it can lead to a breakdown in the patient-provider relationship and a delay in necessary care. Legally, it could be construed as a failure to meet the standard of care if a delay is subsequently identified. Another incorrect approach is to rely solely on a single developmental screening tool without further clinical correlation. While screening tools are valuable, they are designed to identify children who may need further evaluation, not to provide a definitive diagnosis. Over-reliance on a tool without considering the child's overall presentation and parental input can lead to either false positives or false negatives, both of which are detrimental to patient care. This approach neglects the nuanced clinical judgment required in pediatric development assessment. A third incorrect approach is to attribute all observed delays solely to environmental factors without a comprehensive developmental assessment. While environmental influences are significant, they do not preclude underlying developmental disorders. This approach risks overlooking treatable conditions or conditions that require specific interventions, thereby delaying appropriate management and potentially impacting the child's long-term development. It represents a failure to conduct a thorough differential diagnosis. Professional reasoning. When faced with concerns about a child's growth and development, a family physician should employ a systematic approach. This begins with actively listening to and validating parental concerns. Next, a detailed history should be obtained, focusing on developmental milestones, family history, and any relevant prenatal or perinatal factors. A thorough physical examination, including a specific assessment of developmental domains, motor, language, social-emotional, cognitive, should be performed. Age-appropriate standardized developmental screening tools should be utilized as part of the assessment, but not as the sole determinant. If concerns persist or are significant, referral to appropriate specialists, e.g., developmental pediatrician, speech therapist, occupational therapist, for further evaluation and management is indicated. This multifaceted approach ensures comprehensive care and adherence to best practices as outlined by professional organizations like the AAP. Question 9. Process analysis reveals that a pregnant patient expresses a strong desire to incorporate a specific, non-medically endorsed herbal supplement into her prenatal care regimen, citing anecdotal evidence of its benefits. The physician's responsibility is to guide the patient towards safe and effective prenatal care. Which of the following approaches best aligns with regulatory requirements and ethical best practices for pregnancy care and prenatal counseling in the United States? Option A. Firmly advise the patient that only evidence-based medical interventions are acceptable during pregnancy and dismiss the herbal supplement as irrelevant to her care. Option B. Engage in a detailed discussion about the patient's beliefs and preferences. Provide clear, evidence-based information regarding the proposed herbal supplement's safety and efficacy, or lack thereof. Explain the benefits and risks of standard prenatal care, and collaboratively develop a safe and informed care plan. Option C. Present the herbal supplement as a viable alternative to standard prenatal vitamins and screenings, emphasizing its perceived benefits without thoroughly discussing the scientific evidence or potential risks. Option D. Immediately agree to incorporate the herbal supplement into the prenatal care plan to respect the patient's autonomy, without further investigation into its potential risks or interactions with standard medical care. The correct answer is B. Engage in a detailed discussion about the patient's beliefs and preferences. Provide clear, evidence-based information regarding the proposed herbal supplement's safety and efficacy, or lack thereof. Explain the benefits and risks of standard prenatal care, and collaboratively develop a safe and informed care plan. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in family medicine, balancing patient autonomy with the physician's duty to provide evidence-based, safe care during pregnancy. The patient's desire for a specific, potentially unproven, complementary therapy clashes with established prenatal guidelines, and the need for informed consent regarding risks and benefits. The physician must navigate this delicate situation with sensitivity, respect for the patient's beliefs, and a commitment to the well-being of both mother and fetus, all within the framework of U.S. federal and state regulations governing medical practice and patient rights. Correct approach analysis. The correct approach prioritizes open communication, patient education, and shared decision-making, aligning with the principles of informed consent and patient autonomy as mandated by U.S. healthcare law and ethical guidelines. This involves thoroughly discussing the evidence, or lack thereof, for the proposed therapy, its potential interactions with conventional prenatal care, and the established benefits and risks of standard prenatal interventions. The physician's role is to empower the patient with accurate information to make a decision that is both personally meaningful and medically sound, ensuring that any chosen course of action is safe and documented. This approach upholds the physician's responsibility to provide quality care while respecting the patient's right to make choices about their own body and pregnancy. Incorrect approach is analysis. One incorrect approach involves dismissing the patient's request outright without thorough discussion. This violates the principle of patient autonomy and can erode trust, potentially leading the patient to pursue unmonitored or unsafe alternatives. Ethically, it fails to engage in shared decision-making. Legally, it could be construed as a failure to adequately inform the patient of their options and risks. Another incorrect approach is to immediately agree to the patient's request without a comprehensive assessment of its safety or potential impact on the pregnancy. This disregards the physician's professional responsibility to provide evidence-based care and could expose the patient and fetus to unknown risks, violating the duty of care and potentially leading to adverse outcomes. This approach fails to adhere to established medical standards and could have legal ramifications. A third incorrect approach is to present the complementary therapy as equally valid to conventional prenatal care without clearly delineating the scientific evidence supporting each. This misrepresents the current medical consensus and can mislead the patient, undermining the informed consent process. It fails to uphold the physician's ethical obligation to provide accurate medical information and could lead to suboptimal pregnancy outcomes. Professional reasoning. Professionals should approach such situations by first actively listening to the patient's concerns and understanding their motivations for seeking alternative therapies. This should be followed by a clear, evidence-based explanation of standard prenatal care, its benefits and risks. The physician should then address the proposed complementary therapy, discussing available scientific literature, potential interactions, and any known risks or lack of efficacy. The goal is to collaboratively develop a care plan that respects the patient's values while ensuring the safety and well-being of the pregnancy, with all discussions and decisions thoroughly documented in the patient's medical record. Question 10. Process analysis reveals that a 15-year-old patient presents for counseling regarding concerns about peer pressure related to substance use. The patient explicitly requests that their parents not be informed about this specific visit. Under the regulatory framework and laws applicable to the American Board of Family Medicine, what is the most appropriate course of action for the physician? Option A. Inform the parents immediately about the visit and the nature of the counseling, as parental consent is always required for any healthcare service for a minor. Option B. Refuse to provide any counseling or information to the adolescent until parental consent is obtained, citing the minor's age. Option C. Provide counseling and maintain confidentiality, as many states allow minors to consent to counseling for substance use issues without parental notification. And respecting the adolescent's autonomy is paramount in such sensitive matters. Option D. Share the details of the counseling session with the parents without the adolescent's consent, as the physician has a duty to inform parents of their child's health concerns. The correct answer is C. Provide counseling and maintain confidentiality, as many states allow minors to consent to counseling for substance use issues without parental notification, and respecting the adolescent's autonomy is paramount in such sensitive matters. Explanation. Scenario analysis. This scenario presents a common challenge in adolescent healthcare where a minor seeks sensitive health information and services. But parental consent is a significant legal and ethical consideration. The physician must balance the adolescent's right to privacy and access to care with parental rights and legal obligations. The specific age of the adolescent and the nature of the health issue are critical factors in determining the appropriate course of action under U.S. federal and state laws governing minors' health care. Correct approach analysis. The correct approach prioritizes adherence to the American Board of Family Medicine's ABFM, scope of practice, and the prevailing U.S. legal framework for adolescent health care. This involves understanding when parental consent is legally required versus when an adolescent can consent independently or when confidentiality can be maintained without parental notification. For sensitive services like reproductive health, mental health, or substance abuse treatment, many U.S. states have specific laws allowing minors to consent to these services, often with provisions for confidentiality. The physician's duty is to assess the situation within these legal parameters, ensuring the adolescent receives appropriate care while respecting legal mandates regarding parental involvement. This approach upholds both the adolescent's well-being and the physician's legal and ethical obligations. Incorrect approach is analysis. An approach that immediately insists on parental consent without assessing the specific legal allowances for adolescent consent to sensitive services fails to recognize established exceptions in U.S. law. This can deter adolescents from seeking necessary care, violating ethical principles of beneficence and non-maleficence, and potentially contravening state statutes that permit minor consent for certain health services. An approach that unilaterally provides sensitive health information to parents without the adolescent's consent or without a clear legal basis, e.g., imminent danger, breaches patient confidentiality. This violates federal regulations like HIPAA and ethical standards, eroding trust and potentially causing significant harm to the adolescent. An approach that dismisses the adolescent's concerns or refuses to provide any information or counseling without parental involvement, regardless of the legal framework, is a failure to provide appropriate care. This can leave the adolescent without essential support and information, potentially leading to negative health outcomes. Professional reasoning. Professionals should employ a decision-making framework that begins with understanding the patient's age and the nature of the health issue. They must then consult relevant U.S. federal and state laws and ABFM guidelines regarding minors' consent and confidentiality for the specific service requested. If the law permits the adolescent to consent independently, or if confidentiality is mandated, the physician should proceed accordingly, offering counseling and services. If parental consent is legally required, the physician should explore options for involving parents in a supportive manner, while still respecting the adolescent's privacy as much as legally permissible. If there are concerns about the adolescent's safety or well-being that necessitate parental notification, this should be done transparently with the adolescent, if possible, and in accordance with legal reporting requirements. Question 11. Cost-benefit analysis shows that widespread immunization significantly reduces the incidence of serious infectious diseases and associated healthcare burdens. A 45-year-old patient expresses hesitancy about receiving the influenza vaccine, citing anecdotal reports of side effects and a belief that they are rarely ill. The physician needs to conduct a risk assessment to determine the best course of action. Which approach best aligns with current U.S. regulatory frameworks and ethical best practices for family medicine? Option A. Strongly insist on immediate influenza vaccination, emphasizing the patient's obligation to public health and dismissing their concerns as unfounded misinformation. Option B. Conduct a thorough discussion about the patient's specific risk factors for influenza complications, the proven efficacy and safety profile of the influenza vaccine based on CDC data, and address their concerns with evidence-based information, collaboratively developing a personalized vaccination plan. Option C. Defer the influenza vaccination discussion until the patient experiences a significant illness, at which point the benefits of vaccination will be more apparent. Option D. Provide general statistics on influenza mortality rates without inquiring about the patient's personal health history or addressing their specific concerns about side effects. The correct answer is B. Conduct a thorough discussion about the patient's specific risk factors for influenza complications, the proven efficacy and safety profile of the influenza vaccine based on CDC data, and address their concerns with evidence-based information, collaboratively developing a personalized vaccination plan. Explanation. This scenario is professionally challenging because it requires balancing individual patient autonomy and informed consent with public health recommendations, and the physician's ethical duty to protect patients from preventable diseases. The physician must navigate potential patient hesitancy, misinformation, and varying levels of health literacy, while ensuring adherence to established immunization guidelines. The correct approach represents best professional practice because it prioritizes a comprehensive risk assessment tailored to the individual patient's unique circumstances, medical history, and lifestyle, aligning with the American Board of Family Medicine's emphasis on patient-centered care and evidence-based medicine. This approach involves a thorough discussion of vaccine benefits, risks, and alternatives, empowering the patient to make an informed decision. It also adheres to CDC immunization schedules and recommendations, which are the primary regulatory framework for immunizations in the U.S. Ethical considerations of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, are central to this approach. An incorrect approach that focuses solely on the patient's immediate expressed concerns, without a broader risk assessment, fails to uphold the physician's duty to educate and protect the patient from potential future harm. This neglects the long-term benefits of immunization against serious infectious diseases. Another incorrect approach that dismisses patient concerns outright or uses coercive language violates principles of patient autonomy and informed consent, potentially damaging the patient-physician relationship and leading to distrust in medical recommendations. Relying solely on generalized statistics without considering individual risk factors can also be problematic, as it may not accurately reflect the patient's specific vulnerability or the prevalence of disease in their community. Professionals should employ a shared decision-making model. This involves actively listening to patient concerns, providing clear and accurate information about recommended immunizations, discussing individual risk factors for both the disease and the vaccine, and collaboratively developing a vaccination plan that respects the patient's values and beliefs while adhering to public health guidelines. This process ensures that the patient feels heard and respected, increasing the likelihood of adherence to recommended preventive care. Question 12. Comparative studies suggest that for patients newly diagnosed with stage 1 hypertension, a comprehensive approach to lifestyle modification counseling is more effective than a singular focus on pharmacotherapy. Considering the American Board of Family Medicine's emphasis on preventive care and patient-centered management, which of the following counseling strategies would best align with best professional practice for initiating lifestyle modifications? Option A. Deliver a detailed didactic lecture on the DASH diet and the importance of aerobic exercise, providing a printed brochure with general recommendations. Option B. Engage in a collaborative discussion to understand the patient's current lifestyle, identify potential barriers to change, and co-create personalized, actionable goals for diet and physical activity, offering resources and follow-up support. Option C. Provide a list of recommended dietary changes and exercise routines, emphasizing that adherence is solely the patient's responsibility. Option D. Prescribe a low-dose thiazide diuretic and instruct the patient to return in 6 months, assuming they will independently research and implement necessary lifestyle changes. Correct answer is B. Engage in a collaborative discussion to understand the patient's current lifestyle, identify potential barriers to change, and co-create personalized, actionable goals for diet and physical activity, offering resources and follow-up support. Explanation. This scenario presents a common challenge in family medicine, effectively counseling patients on lifestyle modifications for chronic disease management, specifically hypertension. Professional challenge lies in tailoring advice to individual patient circumstances, ensuring comprehension, and fostering sustainable behavioral change within the constraints of a typical clinical encounter. It requires not just knowledge of guidelines, but also strong communication and motivational interviewing skills. The correct approach represents best professional practice because it prioritizes patient-centered care and evidence-based counseling strategies. It involves a collaborative discussion, actively involving the patient in goal setting and problem solving, and providing practical, actionable advice. This aligns with the American Board of Family Medicine's emphasis on comprehensive patient care and the principles of shared decision-making, which are implicitly supported by the off-position statements on preventive care and patient education. The focus on understanding the patient's barriers and tailoring recommendations accordingly is crucial for adherence and long-term success, reflecting a commitment to patient well-being and autonomy. An incorrect approach that focuses solely on prescribing medication without addressing lifestyle factors fails to meet the comprehensive care standards expected in family medicine. This neglects the foundational role of lifestyle in managing hypertension and may lead to suboptimal patient outcomes and increased reliance on pharmacotherapy. Ethically, it could be seen as a failure to provide adequate patient education and explore all appropriate management options. Another incorrect approach that involves delivering a generic lecture on diet and exercise without assessing the patient's readiness or understanding is unlikely to be effective. This approach is not patient-centered and disregards the principles of adult learning and motivational interviewing, which are essential for facilitating behavioral change. It may lead to patient disengagement and a perception that their individual needs are not being met, potentially undermining the therapeutic relationship. A third incorrect approach that relies on simply handing out pamphlets and assuming the patient will implement the advice overlooks the complexity of behavior change. While educational materials can be a useful adjunct, they are rarely sufficient on their own. This approach fails to engage the patient in a meaningful dialogue, identify potential barriers, or provide personalized support, thus diminishing the likelihood of successful lifestyle modification. It represents a passive, rather than active approach to patient counseling. The professional decision-making process for similar situations should involve 1. Assessing the patient's current health status and risk factors. 2. Eliciting the patient's understanding of their condition and their readiness for change. 3. Collaboratively setting realistic, achievable goals. 4. Providing tailored, evidence-based recommendations, considering individual preferences and barriers. 5. Employing motivational interviewing techniques to enhance self-efficacy and commitment. 6. Scheduling follow-up to monitor progress and provide ongoing support. Question 13. Assessment of a 72-year-old male with a history of COPD, congestive heart failure, CHF, and type 2 diabetes mellitus, DM, presenting with increased shortness of breath, cough, and lower extremity edema. His baseline symptoms have worsened over the past 48 hours. He lives alone and has had difficulty managing his medications recently due to tremors. Which of the following initial approaches best guides the management of this patient's acute presentation? Option A. Initiate intravenous diuretics and bronchodilators, obtain a chest X-ray and ECG, and closely monitor vital signs and oxygen saturation. Option B. Focus on symptom relief with supplemental oxygen and a mild sedative, and schedule a follow-up appointment in 2 weeks. Option C. Immediately arrange for home health services to manage his medications and schedule a follow-up with his cardiologist. Option D. Administer a short course of oral corticosteroids and antibiotics, and advise the patient to increase his fluid intake. The correct answer is A. Initiate intravenous diuretics and bronchodilators, obtain a chest X-ray and ECG, and closely monitor vital signs and oxygen saturation. Explanation. Scenario analysis. This scenario presents a common yet complex challenge in family medicine, managing an acute exacerbation of a chronic condition in a patient with multiple comorbidities and limited social support. The professional challenge lies in rapidly and accurately assessing the severity of the exacerbation, differentiating it from a new acute illness, and developing a management plan that addresses both the immediate crisis and the underlying chronic disease trajectory, all while considering the patient's capacity for self-care and available resources. The presence of multiple chronic conditions, COPD, CHF, DM, increases the risk of polypharmacy, drug interaction, and diagnostic ambiguity. The limited social support adds a layer of urgency to discharge planning and the need for robust outpatient follow-up. Correct approach analysis. The correct approach prioritizes a comprehensive assessment that integrates objective findings with the patient's subjective experience and functional status. This aligns with the American Board of Family Medicine's emphasis on holistic patient care and evidence-based management. Specifically, a thorough history focusing on changes in baseline symptoms, a detailed physical examination to identify signs of decompensation, and targeted investigations, e.g., Chest X-ray, EC, laboratory studies are crucial for accurate diagnosis and severity stratification. The management plan must then be tailored to the individual patient, addressing the acute exacerbation while optimizing chronic disease management and ensuring safe discharge with appropriate follow-up and support. This approach reflects the principles of patient-centered care and adherence to established clinical guidelines for managing chronic diseases, as expected by the ABFM. Incorrect approach is analysis, an approach that solely focuses on treating the most prominent symptom without a comprehensive assessment risks misdiagnosis and inadequate management of the underlying chronic condition. This could lead to delayed or inappropriate treatment, potentially worsening the patient's condition and increasing healthcare utilization. Ethically, this represents a failure to provide adequate care and a deviation from professional standards. An approach that relies heavily on empirical treatment, without a clear diagnostic rationale or consideration of the patient's comorbidities, could lead to adverse drug events, polypharmacy issues, and a failure to address the root cause of the exacerbation. This is professionally unacceptable as it deviates from evidence-based practice and patient safety principles. An approach that prioritizes rapid discharge without ensuring adequate outpatient support or a clear follow-up plan, especially in a patient with limited social resources, poses a significant risk of readmission and poor outcomes. This demonstrates a failure to consider the patient's overall well-being and discharge readiness, which is a critical ethical and professional responsibility. Professional reasoning. The decision-making process for managing acute exacerbations of chronic diseases should follow a structured approach. 1. Acute assessment. Rapidly evaluate the patient's airway, breathing, and circulation. Assess vital signs and level of consciousness. 2. Symptom characterization. Elicit a detailed history of the current symptoms, focusing on changes from baseline, duration, severity, and precipitating factors. 3. Comorbidity review. Thoroughly review the patient's existing chronic conditions and their current management. 4. Physical examination. Perform a targeted physical exam to identify objective signs of exacerbation and complications. 5. Diagnostic workup. Order appropriate investigations based on the suspected diagnosis and severity. 6. Differential diagnosis. Consider alternative diagnoses that could mimic or contribute to the exacerbation. 7. Management plan. Develop a treatment plan that addresses the acute exacerbation, optimizes chronic disease management, and considers potential drug interactions. 8. Discharge planning. Assess the patient's readiness for discharge, including functional status, understanding of their condition, medication adherence, and availability of social support. Establish a clear follow-up plan with appropriate referrals. Question 14. When evaluating a patient presenting with new-onset anxiety symptoms and a history of mild depression, what is the most appropriate initial step for a family physician to take to ensure comprehensive behavioral health management? Option A. Advise the patient to seek out a behavioral health provider independently and document the conversation without facilitating the referral process. Option B. Schedule a follow-up appointment in 3 months to reevaluate the anxiety symptoms, assuming they may resolve spontaneously. Option C. Initiate a referral to a qualified behavioral health specialist for a formal assessment and treatment plan, while providing supportive counseling and discussing initial coping strategies. Option D. Prescribe an anxiolytic medication immediately to alleviate the patient's acute symptoms, deferring a formal referral until the medication's effectiveness is assessed. The correct answer is C. Initiate a referral to a qualified behavioral health specialist for a formal assessment and treatment plan, while providing supportive counseling and discussing initial coping strategies. Explanation. This scenario is professionally challenging because it requires balancing the patient's immediate need for behavioral health support with the established protocols for referral and continuity of care within the American Board of Family Medicine's ABFM scope. The family physician must consider the patient's well-being, the effectiveness of the proposed intervention, and adherence to professional standards. The correct approach represents best professional practice because it prioritizes a comprehensive assessment and a structured referral process, aligning with ABFM guidelines that emphasize evidence-based care and patient-centered approaches. This ensures the patient receives appropriate, specialized care while maintaining a clear record of the referral and the rationale behind it. It also supports collaborative care models, which are increasingly recognized as essential for integrated behavioral health services. An incorrect approach that involves directly prescribing medication without a formal behavioral health assessment, fails to adhere to the principle of appropriate scope of practice and may not address the underlying behavioral health issue effectively. This could lead to suboptimal patient outcomes and potential regulatory or ethical concerns related to practicing outside one's expertise or failing to utilize available specialized resources. Another incorrect approach, such as delaying the referral due to administrative burden, neglects the patient's immediate needs and could be seen as a failure to provide timely care. This can undermine patient trust and potentially worsen the behavioral health condition, violating ethical obligations to act in the patient's best interest. A further incorrect approach, such as referring the patient to a provider with whom the family physician has no established collaborative relationship or referral pathway, risks fragmented care and a lack of communication between providers. This can lead to gaps in treatment, duplication of services, and a diminished ability to monitor the patient's progress effectively, which is contrary to best practices in coordinated care. The professional decision-making process should involve a thorough assessment of the patient's behavioral health needs, identification of appropriate referral resources within the established healthcare network, clear communication with the patient about the referral process and expectations, and documentation of the referral and the rationale. This systematic approach ensures that patient care is both effective and compliant with professional standards. Question 15. Process analysis reveals that a 78-year-old patient with mild cognitive impairment, diagnosed with early-stage Alzheimer's disease, expresses a strong desire to remain living independently at home, despite her adult children expressing significant concerns about her safety and ability to manage daily tasks. The family is requesting that the physician initiate a process for assisted living placement. As the patient's primary care physician, what is the most appropriate initial step to take in addressing this complex situation? Option A. Conduct a comprehensive geriatric assessment to evaluate the patient's current functional status, cognitive capacity for decision-making, and identify specific safety risks and support needs. Option B. Schedule a meeting with the family to discuss their concerns and inform them that the patient's decision is final without further assessment of the patient. Option C. Immediately initiate the process for assisted living placement as requested by the concerned family members. Option D. Advise the patient that her wishes to remain independent are paramount and disregard the family's concerns due to her stated preference. The correct answer is A. Conduct a comprehensive geriatric assessment to evaluate the patient's current functional status, cognitive capacity for decision-making, and identify specific safety risks and support needs. Explanation: scenario analysis. This scenario is professionally challenging because it involves a complex interplay of patient autonomy, family dynamics, and the physician's ethical and legal obligations in providing care for an elderly patient with cognitive impairment. The physician must navigate the patient's expressed wishes against the family's concerns, ensuring the patient's best interests are met while respecting their dignity and rights. This requires careful assessment, clear communication, and adherence to established ethical guidelines and regulatory frameworks governing geriatric care and decision-making capacity. Correct approach analysis. The correct approach prioritizes a comprehensive, individualized assessment of the patient's functional status, cognitive abilities, and social support system. This aligns with the principles of patient-centered care and the American Board of Family Medicine's emphasis on holistic health. A thorough geriatric assessment, as mandated by best practices in family medicine, allows the physician to objectively evaluate the patient's capacity to make decisions, identify potential risks and benefits of different care options, and develop a care plan that respects the patient's autonomy to the greatest extent possible, while also addressing the family's valid concerns. This approach is ethically sound, promoting beneficence and non-maleficence, and legally defensible by ensuring informed consent or appropriate surrogate decision-making processes are followed. Incorrect approach is analysis. One incorrect approach would be to solely defer to the family's wishes without a thorough independent assessment of the patient's capacity. This violates the ethical principle of patient autonomy and could lead to a care plan that is not aligned with the patient's actual preferences or best interests, potentially causing distress or harm. It also fails to meet the professional standard of care for geriatric patients, which mandates an individualized assessment. Another incorrect approach would be to disregard the family's concerns entirely and proceed solely based on the patient's stated wishes, even if there are clear indicators of impaired judgment or understanding. While patient autonomy is paramount, it must be exercised within the bounds of capacity. Ignoring significant family concerns without proper investigation could lead to a suboptimal care plan and strained patient-physician-family relationships, potentially overlooking critical safety issues. A third incorrect approach would be to make a unilateral decision about the patient's care without engaging in a structured assessment process or facilitating communication between the patient and family. This bypasses essential steps in ethical and professional decision-making, failing to gather necessary information, and potentially leading to a decision that is not well-informed or universally accepted, thereby undermining trust and collaborative care. Professional reasoning. Professionals should employ a structured decision-making process that begins with a comprehensive geriatric assessment. This assessment should include evaluating cognitive function, physical health, psychological well-being, and social circumstances. Following the assessment, the physician should engage in open and honest communication with the patient, exploring their preferences, values, and understanding of their situation. Simultaneously, the physician should involve the family, sharing relevant information with patient consent and listening to their concerns. If capacity is questionable, formal capacity evaluations should be conducted. The ultimate care plan should be a collaborative effort, prioritizing the patient's autonomy while ensuring their safety and well-being, and adhering to all relevant ethical guidelines and legal requirements. Question 16. System analysis indicates a 4-year-old child presents with a 3-day history of fever, cough, and decreased appetite. The child has had a mild runny nose for a week prior. On examination, the child is alert but appears fatigued. Vital signs are stable with a temperature of 101, 5 degrees F 38, 6 degrees C. Lung auscultation reveals scattered rhonchi bilaterally with no focal consolidation. Tympanic membranes are clear. Throat is erythematous without exudate. Which of the following management strategies best reflects current best practices for family physicians in the United States when managing this common acute condition? Option A. Reassure the family that this is likely a viral illness, advise supportive care with fluids and rest, and schedule a follow-up appointment in 7 days if symptoms persist or worsen. Option B. Prescribe a course of amoxicillin for suspected bacterial bronchitis, with instructions for the family to return if symptoms worsen. Option C. Initiate empiric treatment with a macrolide antibiotic for atypical pneumonia, as the presentation is somewhat vague. Option D. Order a complete blood count, CBC, with differential and a chest X-ray to rule out pneumonia, given the fever and cough. Correct answer is B. Prescribe a course of amoxicillin for suspected bacterial bronchitis, with instructions for the family to return if symptoms worsen. Explanation. Scenario analysis. This case presents a common challenge in family medicine. Managing a pediatric patient with a suspected acute bacterial infection where the clinical presentation is not entirely classic and the family is anxious. The physician must balance the need for prompt and effective treatment with avoiding unnecessary antibiotic use, considering potential side effects and the broader issue of antimicrobial resistance. The family's desire for a definitive diagnosis and immediate relief adds pressure to the decision-making process. Correct approach analysis. The correct approach involves a thorough history and physical examination to gather all relevant clinical data, followed by a discussion with the family about the differential diagnosis, the rationale for diagnostic testing, and the treatment plan, including potential risks and benefits. This aligns with the American Board of Family Medicine's emphasis on evidence-based medicine, patient-centered care, and shared decision-making. Specifically, it reflects the principles of good medical practice by ensuring informed consent and a collaborative approach to managing the child's health, adhering to guidelines for judicious antibiotic prescribing. Incorrect approaches analysis. One incorrect approach would be to immediately prescribe broad-spectrum antibiotics without a clear indication or further investigation. This fails to adhere to antimicrobial stewardship principles, potentially contributing to antibiotic resistance and exposing the child to unnecessary side effects. It also bypasses the crucial step of shared decision-making with the family regarding the diagnostic and treatment plan. Another incorrect approach would be to dismiss the family's concerns and reassure them without a comprehensive evaluation or a clear plan for follow-up. This neglects the physician's ethical obligation to address patient and family anxieties and can lead to a breakdown in trust. It also fails to adequately investigate a potentially serious condition. A third incorrect approach would be to order a battery of extensive and potentially invasive tests without a clear diagnostic rationale, leading to increased costs, patient discomfort, and potential for iatrogenic harm without a proportionate benefit. This deviates from the principle of performing necessary and appropriate investigations. Professional reasoning. Professionals should approach such scenarios by first prioritizing a comprehensive clinical assessment. This involves active listening to the patient/family's concerns, a detailed history, and a thorough physical examination. Next, a differential diagnosis should be formulated, considering the most likely causes and their severity. Based on this, a diagnostic plan, including appropriate investigations, should be developed, always weighing the benefits against the risks and costs. Treatment options should then be discussed with the patient/family, emphasizing shared decision-making, explaining the rationale, potential outcomes, and alternatives. Finally, a clear follow-up plan is essential to monitor progress and adjust the management as needed. Question 17. Upon reviewing a patient presenting with acute severe abdominal pain and signs of peritonitis, the patient, who appears somewhat disoriented and agitated, explicitly refuses all further diagnostic workup and treatment, stating they want to go home. The physician suspects the patient may not fully comprehend the gravity of their condition or the implications of their refusal. What is the most appropriate course of action for the physician in this acute care setting? Option A. Immediately contact the patient's family to authorize treatment, as the patient is clearly not making a rational decision. Option B. Proceed with the necessary diagnostic tests and treatments without further discussion, as the patient's refusal is not medically sound in this acute situation. Option C. Conduct a thorough assessment of the patient's decision-making capacity regarding their current medical situation and proposed treatments. Option D. Document the patient's refusal and discharge them home, as the patient has the right to refuse any medical intervention. The correct answer is C. Conduct a thorough assessment of the patient's decision-making capacity regarding their current medical situation and proposed treatments. Explanation. This scenario presents a common ethical dilemma in acute care where a physician's professional obligations clash with a patient's expressed wishes, complicated by the patient's potentially impaired decision-making capacity. Challenge lies in balancing patient autonomy with the physician's duty to provide appropriate care and prevent harm, all within the framework of American Board of Family Medicine, ABFM, standards which emphasize patient-centered care and adherence to ethical principles. The correct approach prioritizes a thorough assessment of the patient's capacity to make informed decisions regarding their acute condition. This involves a systematic evaluation of their understanding of their illness, the proposed treatment, alternatives, and the consequences of refusing treatment. If capacity is confirmed, the physician must respect the patient's autonomous decision, even if it differs from the physician's medical judgment, provided the decision is informed and voluntary. This aligns with the ABFM commitment to ethical practice and patient rights, as well as general medical ethics principles of beneficence, non-maleficence, and respect for autonomy. An incorrect approach would be to immediately override the patient's wishes based solely on the physician's belief that the patient is making a poor decision, without first assessing capacity. This disregards the principle of patient autonomy and could lead to a violation of the patient's rights. Another incorrect approach would be to proceed with treatment without attempting to understand the patient's reasoning or exploring less restrictive alternatives that might still achieve the desired medical outcome while respecting the patient's preferences. This fails to engage in shared decision-making and can erode the patient-physician relationship. Finally, abandoning the patient or transferring care without proper consultation and ensuring continuity of care would be a failure of the physician's duty of care. Professional decision-making in such situations requires a structured approach. First, assess the patient's decision-making capacity. Second, if capacity is present, engage in shared decision-making, exploring the patient's values and preferences. Third, if capacity is lacking, involve surrogate decision-makers and act in the patient's best interest, documented thoroughly. And fourth, always maintain open communication and respect for the patient, even when disagreeing on treatment. Question 18. During the evaluation of a 45-year-old male presenting for his annual physical, the physician notes a slight tremor in his hands and a history of multiple unexplained injuries over the past year. The patient denies any current illicit drug use or excessive alcohol consumption. Which of the following approaches best aligns with current U.S. primary care guidelines for screening and intervention for substance use disorders in this context? Option A. Immediately refer the patient to an addiction specialist for a comprehensive evaluation without any initial screening or intervention. Option B. Document the patient's denial and proceed with the remainder of the physical examination, assuming no substance use disorder is present. Option C. Directly confront the patient about the possibility of substance abuse based on the observed tremor and past injuries, demanding a confession. Option D. Administer a validated screening questionnaire for alcohol and drug use, and if positive, engage in a brief intervention and discuss potential referral options. The correct answer is D. Administer a validated screening questionnaire for alcohol and drug use, and if positive, engage in a brief intervention and discuss potential referral options. Explanation. Scenario analysis. This scenario presents a common challenge in primary care, identifying and addressing potential substance use disorders in a patient who may not overtly present with symptoms or admit to problems. The physician must balance the need for accurate screening, patient rapport, and adherence to best practices in addiction medicine, all within the context of the American Board of Family Medicine's ABFM scope of practice and relevant U.S. federal and state regulations regarding patient privacy and healthcare delivery. The professional challenge lies in selecting an intervention that is both evidence-based and tailored to the patient's readiness for change, while respecting their autonomy and avoiding stigmatization. Correct approach analysis. The correct approach involves utilizing a validated screening tool appropriate for the primary care setting, followed by a brief intervention if indicated by the screening results. This aligns with ABFM emphasis on evidence-based medicine and the integration of behavioral health into primary care. Federal regulations like HIPAA ensure patient confidentiality, which is crucial when discussing sensitive topics like substance use. Furthermore, the principle of patient-centered care, a cornerstone of family medicine, dictates that interventions should be collaborative and respect the patient's readiness for change, as outlined in motivational interviewing principles often taught in family medicine residency. This approach prioritizes early identification and intervention, which is more effective and less costly than treating advanced addiction. Incorrect approach is analysis. One incorrect approach would be to ignore potential signs of substance use due to a lack of direct patient admission or a desire to avoid uncomfortable conversations. This fails to meet the professional obligation to provide comprehensive care and can lead to delayed diagnosis and treatment, potentially worsening the patient's condition. Ethically, it represents a failure to act in the patient's best interest. Another incorrect approach would be to immediately refer the patient to a specialist without any initial screening or brief intervention. While specialist referral is sometimes necessary, bypassing the primary care physician's role in initial assessment and intervention can be inefficient and may alienate patients who are not yet ready for intensive treatment. It also misses the opportunity for the primary care physician to establish rapport and provide foundational support. A third incorrect approach would be to confront the patient aggressively about suspected substance use without a structured screening process or a plan for intervention. This can lead to defensiveness, damage the patient-physician relationship, and make the patient less likely to engage in future care. It violates principles of patient-centered communication and can be perceived as judgmental, which is counterproductive in addressing substance use disorders. Professional reasoning. When evaluating a patient for potential substance use disorders, the professional decision-making process should begin with a systematic approach. This involves considering the patient's presenting complaint, medical history, and any subtle cues that might suggest substance use. The next step is to employ a validated screening tool, such as the Audit-C or DAS-10, which are widely accepted in primary care. Based on the screening results, a brief intervention which may include providing feedback, exploring consequences, and discussing options for change should be offered. If the patient expresses readiness for change, a referral to appropriate resources can be made. Throughout this process, maintaining a non-judgmental, empathetic, and collaborative approach is paramount, ensuring patient confidentiality and respecting their autonomy. Question 19. The control framework reveals a family physician evaluating a 4-year-old presenting with recurrent bruising, vague abdominal pain, and a history of falls that seem inconsistent with the described mechanisms. The parents appear concerned and cooperative, but the physician notes subtle discrepancies in their accounts of the injuries. The physician's primary responsibility is to ensure the child's well-being while navigating the complexities of diagnosis and potential reporting. Which of the following approaches best aligns with the physician's ethical and legal obligations in this situation? Option A. Immediately confront the parents with the suspicion of child abuse, demanding an explanation for the bruising and abdominal pain, and threatening to involve law enforcement if their answers are unsatisfactory. Option B. Document the observed symptoms and parental statements, but defer any reporting to Child Protective Services until definitive proof of abuse is obtained, which may involve waiting for further injuries to occur. Option C. Reassure the parents that the symptoms are likely due to the child's active nature and the stress of a recent family move, and suggest follow-up if symptoms persist, without initiating further investigation into potential abuse. Option D. Conduct a thorough physical examination. Gather detailed histories from all available sources. Consider a broad differential diagnosis including non-accidental trauma. Consult with a child abuse specialist. And if suspicion remains significant after this comprehensive evaluation, make a timely report to Child Protective Services as mandated by state law. The correct answer is D. Conduct a thorough physical examination. Gather detailed histories from all available sources. Consider a broad differential diagnosis including non-accidental trauma. Consult with a child abuse specialist. And if suspicion remains significant after this comprehensive evaluation, make a timely report to Child Protective Services as mandated by state law. Explanation. Scenario analysis. This scenario presents a common yet complex challenge in family medicine. Identifying and addressing potential child abuse or neglect in a pediatric patient exhibiting concerning symptoms that could have multiple etiologies. The physician must balance the immediate need to protect the child with the importance of accurate diagnosis, avoiding premature conclusions, and maintaining the patient-physician relationship with the family. The ambiguity of symptoms, coupled with the potential for severe consequences for both the child and the family, necessitates a rigorous and ethically sound approach. Correct approach analysis. The correct approach emphasizes a systematic, evidence-based evaluation that prioritizes the child's safety while adhering to mandated reporting laws. This involves a thorough history from all available sources, a comprehensive physical examination, and consideration of differential diagnoses. Crucially, it includes consulting with appropriate specialists, e.g., child abuse pediatrician, social worker, and if suspicion remains high after initial evaluation, making a timely and well-documented report to Child Protective Services as required by state law. This aligns with the American Academy of Pediatrics guidelines and state-specific child abuse reporting statutes, which obligate physicians to report suspected cases. The focus is on gathering information to make an informed decision about reporting, rather than acting solely on initial impressions. Incorrect approaches analysis. One incorrect approach involves dismissing the concerning symptoms due to the family's perceived cooperation or the physician's personal discomfort with the possibility of abuse. This fails to uphold the physician's legal and ethical duty to protect vulnerable children, potentially leaving a child in a dangerous situation. It disregards the principle that abusers can often present as cooperative. Another incorrect approach is to confront the parents directly with accusations of abuse without sufficient evidence or a clear plan for intervention. This can escalate the situation, damage the therapeutic relationship, and potentially lead to the family seeking care elsewhere, thereby hindering further assessment and protection. It may also violate best practices for interviewing and reporting suspected abuse, which often involve a multidisciplinary approach. A third incorrect approach is to delay reporting indefinitely while continuing to gather more information, especially if the initial assessment strongly suggests abuse. While thoroughness is important, there is a point where the risk to the child outweighs the benefit of further non-intervention. This delay can be interpreted as a failure to meet reporting obligations under state law, which typically requires reporting within a specific time frame once suspicion is established. Professional reasoning. When faced with potential child abuse, the professional decision-making process should involve 1. Recognizing and acknowledging concerning signs and symptoms. 2. Conducting a comprehensive and objective assessment, including gathering information from multiple sources. 3. Considering all plausible differential diagnoses. 4. Consulting with colleagues and specialists as needed. 5. Understanding and applying relevant state laws regarding mandated reporting. 6. documenting all findings, assessments, and actions meticulously. 7. Prioritizing the child's safety above all else, while striving for accuracy and fairness. Question 20. Consider a scenario where a 55-year-old male patient presents for his annual physical examination. He is asymptomatic and has no personal or family history of colorectal cancer. According to current U.S. Preventive Services Task Force USPS guidelines, he is due for colorectal cancer screening. The physician has limited time during this visit. Which of the following approaches best reflects adherence to health maintenance and screening guidelines as expected by the American Board of Family Medicine? Option A. Defer colorectal cancer screening for this patient, citing the lack of symptoms and the limited time available during the current visit, with a plan to address it at a future, less busy appointment. Option B. Discuss the options for colorectal cancer screening with the patient, explain the benefits and risks of each, and schedule a follow-up appointment or provide a referral for the chosen screening method. Option C. Recommend a fecal immunochemical test, fit for home collection, providing the patient with the necessary materials and instructions for submission, and discuss the follow-up plan based on the result. Option D. Advise the patient that since he is asymptomatic and has no family history, colorectal cancer screening is not immediately necessary and can be postponed indefinitely. Correct answer is B. Discuss the options for colorectal cancer screening with the patient, explain the benefits and risks of each, and schedule a follow-up appointment or provide a referral for the chosen screening method. Explanation. This scenario presents a common challenge in primary care, balancing evidence-based health maintenance recommendations with individual patient factors and the practicalities of a busy clinical setting. The professional challenge lies in accurately applying the American Board of Family Medicine's ABFM, health maintenance and screening guidelines, which are derived from authoritative sources like the U.S. Preventive Services Task Force USPS and other relevant professional bodies, while also considering the patient's specific history, risk factors, and preferences. It requires a nuanced understanding of when to adhere strictly to guidelines and when to individualize care. The correct approach represents best professional practice because it demonstrates a commitment to evidence-based medicine and patient-centered care, as mandated by ABFM focus on maintaining up-to-date knowledge and skills. Adhering to established screening guidelines, such as those for colorectal cancer screening in an asymptomatic individual within the recommended age range, is a core component of preventive care. This approach ensures that the patient receives recommended screenings that have been proven to improve health outcomes, aligning with the ABFM emphasis on quality patient care and adherence to recognized standards. An incorrect approach that deviates from established guidelines without a clear clinical justification would represent a failure to meet professional standards. For instance, delaying or omitting a recommended screening solely due to time constraints or a perceived lack of patient benefit, without a documented rationale based on the patient's specific contraindications or shared decision-making, would be a regulatory and ethical failure. This could lead to missed opportunities for early disease detection, potentially resulting in poorer patient outcomes and a breach of the physician's duty of care. Another incorrect approach might involve recommending screenings that are not supported by current evidence or guidelines for the patient's demographic and risk profile, which could lead to unnecessary testing, patient anxiety, and increased healthcare costs, also failing to uphold professional standards. The professional decision-making process in such situations should involve a systematic review of current health maintenance guidelines relevant to the patient's age, sex, and risk factors. This includes consulting resources like the USPS recommendations. Following this, a thorough assessment of the individual patient's medical history, family history, lifestyle, and any specific concerns or preferences is crucial. Shared decision-making with the patient, discussing the benefits, risks, and alternatives of recommended screenings, is paramount. Documentation of the rationale for any deviation from standard guidelines based on individual patient factors or shared decisions is essential for accountability and continuity of care.